Thank you. I'm going to join Congressman Kingston. I came in here to learn and to ask some questions, and this seems to me muddier and muddier. And what we're trying to do, of course, is to deliver quality health care in a time where, you know, our men and women are coming back with some terrible, terrible situations, and we do it in an effective, efficient way. And to do that, because we are in a crisis and we know what's coming down, it's more cuts. And so you've got a quagmire here, it seems to me. And are you moving toward that solution? Because it has to happen. I mean, it can't continue. I had a base that was in my district that was set for closure and then realigned as a joint reserve base. And for a while, it looked like instead of saving, we were going to spend as much money as we could to put walls so every branch of the military could have their own set of circumstances. And finally, from good leadership, said, no, we are joint, and we're going to do everything we can joint. We're going to contract jointly. We're going to purchase jointly. We're going to do that. And that's what has to happen. There has to be leadership that says, here are the problems that we're experiencing. And now, how are we going to resolve those? And it may be coming back to us and say, the way you think they can be resolved is not the way they can be resolved. But are you listening also to those that serve? For instance, I think Walter Reed, you know, there are reports that there's a high turnover, that if you have this confusion of command and control, then how does that play out on a day-to-day basis with those medical health care deliverers and certainly the patients that are there? And oftentimes it's at that level they say, hey, this doesn't work. And so we're trying to work around an unworkable situation. So I would hope that if there are successes, and General Green, you talked about those successes, for goodness sakes, let us know that so we can walk out of here at any other meeting with a better picture of what's happening than we have today. And where it's not working, then for goodness sakes, let's work together to say it has to be done this way. If not, it will deteriorate instead of saving money. It won't save money, but it can very, very alarmingly affect the healthcare and delivery of healthcare. So I don't have a question. That's just my observation and concern. Thank you, Mr. Chairman.
Thank you, Ms. Granger. Mr.